Well, breastfeeding is a safe, cost-effective and healthy way to bring up children. And there's no evidence that COVID-19 is transmitted through breast milk. The country is marking Breastfeeding Week under the theme Support Breastfeeding for a Healthier South Africa. Let's chat some more about this now with Stasha Jordan. She's from the South African Breastmilk Reserve. Stasha, a very good morning and thanks so much for your time. And I suppose, yes, you cannot stress this enough about the benefits of breastfeeding. We've been doing it now for years and years and years. And how are we faring, especially in the time of COVID-19? Are we seeing a lot of reluctance, especially among new mums, those who've had babies in this time?
No, we actually don't see reluctance. In fact, we have seen, it really depends on the context and the environment in which we talk about breastfeeding, for babies that have been hospitalized with COVID positive mums, it has been challenging because there is a period of separation where mother and baby cannot be together. So during that, you can imagine that that's a difficult environment. There have been access restrictions placed on hospitals, and that does impact on the mother's ability to access her baby. And we have spoken a lot about that. However, what we are finding, at least from the human milk banking point of view, is that the mums who are at home are lactating and lactating quite well. At least our reserves nearly doubled during the pandemic. So where we usually store 600 units of breast milk as a baseline reserve, we now have 1,200 units, and a lot of very, very generous and involved mums. We've also heard from the private sector that they have seen an increase in breastfeeding rates because mums, rightly so, are concerned about their baby's immune system and COVID-19. And there is no greater testament to the benefits of breastfeeding than to talk about the incredible benefit that it is to building the immune system of the baby and the infant.
Yeah, so now more than ever it seems that we need to be punting breastfeeding because it's the best medicine, I suppose, if I could put it that way, to actually give your children. What are the other challenges, though, at this time? We were constantly hearing about the impacts of COVID-19 on mums and those who are single mums, which amounts to sort of getting the right nutrition into yourself, into your baby as well. Have you seen, especially from those who come to you wanting to access the milk in your reserve bank as well, what are their challenges? What's preventing them from breastfeeding properly?
Well, breastfeeding is where we work in the human milk banking space. We focus primarily on very low birth weight and extremely low birth weight infants in neonatal intensive care unit. And that population is a constant population group that exists in our field. So we seldom really handle the issues around failed lactation, but South Africa has a very strong lactation consulting community, the South African board certified lactation consultants, and then there is ADSA, which do a lot of work in nutrition. I can assure you that one of the biggest challenges surrounds food security. What has happened as a consequence of the pandemic is that 3 million people lost their jobs, and of these, 2 million are women. We have to remember that 1 in 2 households in South Africa is woman-headed, and that puts an incredible pressure on women to feed their families. So we have also pivoted towards food banking. We have launched the Feeding Collective, Disrupting Hunger, and we are distributing food parcels to families with children under 5 and lactating women, because food is the biggest. Food security is the biggest crutch of the pandemic. So we want to feed moms that are breastfeeding. We want to make sure that they are adequately supported and nourished. And that obviously, often on World Breastfeeding Week, we focus primarily on the baby. But we have to remember that we have to empower a woman to breastfeed. We have to empower dads to support women to breastfeed. And the second crutch of the pandemic, and we're all aware, has been this rise in gender-based violence, which obviously impacts the home environment. And, we are thinking about our breastfeeding moms during this time as stakeholders in breastfeeding, and we're talking also on behalf of the South African Civil Society for Women, Adolescents and Children's Health. We really are calling on to strong male role models to show support for their breastfeeding partners during this time.
And just very quickly for us, Stasha, as well, what strides have we made in terms of that support that you are talking about, especially in the workplace? And I think for years now, we've asked for spaces to be created in corporate, in private business, in the public sector as well, where women can actually go and, bank their breast milk for their own babies. Are we winning on that front? And also in terms of what support we provide for these mums, like they do in Europe, where you have somebody who comes to visit you almost every day after you're sent home with your baby to make sure, especially those mums like myself, I struggled to breastfeed. I actually battled. I couldn't. I had to take medication, all those remedies, whatever people said drink, I would drink so that I could try and produce breast milk. It just didn't happen. So are we winning in terms of support on both those levels for our mums here?
I would like to say that we're winning and that we are talking about a very long process that will span a couple of generations, But we have made incredible inroads in improving our breastfeeding rates. And the sustainable goal is to reach 50% breastfeeding rate by 2025. So we are 18% shy of that. And this is up from what was a dismal 7% in 2008, 2009. So if you look at the growing statistic for breastfeeding, you would assume that we are offering better breastfeeding support. And as I say, the community that is supporting breastfeeding mums is evolving with the needs. Yeah. And so are the departments and the public sector hospitals are beginning to see the value of breastfeeding counselors, of breastfeeding support nurses, and so on. So, yes, we're definitely making great progress.
All right, well, thanks so much for that. And let's keep going with that support for our mums. It's so vital for mums and our next generation as well. Stasha Jordan, thanks so much. Still to